health inequalities have been exacerbated and population groups disproportionately impacted. There was a strong sense from across the engagement activities and responses received that underlying problems have been exacerbated by the pandemic. People with long-term conditions have been particularly impacted by deterioration in their health and well-being due to the reduced access to ongoing support and healthcare services necessary for them to self-manage and live well. Unpaid carers have reported the practical and emotional challenges of providing ongoing care during lockdown. Considerable distress has been described at having to provide even more care for loved ones without access to support and respite. They also shared that they have not been treated as equal partners in care throughout the pandemic. People have shared that their experience of pregnancy and maternity services during the pandemic has been anxiety-provoking and isolating due to the reduction in postpartum follow-up services and visitation allowances. People shared the challenges they encountered arranging care and support when English is not their first language. People also reported difficulty accessing virtual health appointments when a translator was required, and some healthcare information and systems were only available in English. People who live in care homes reported feelings of powerlessness and anger at the implementation of rules and restrictions. They also shared how being unable to have visits with family and friends to access outdoor spaces or to take part in social activities within their communities had had a profound negative impact on their mental health and well-being. Quote, "I have panic attacks and feel lonely, feel like I'm in prison." However, carers and staff have been praised for their kindness and professionalism during this time. Lockdown and restrictions have imposed new barriers for people with sensory impairments, including loss of lip reading due to face masks, inability to access appointments accompanied by a support worker, and navigating public areas under social distancing guidelines. People shielding needed additional support during this time, and the pandemic meant support mechanisms usually in place were disrupted. There was also confusion regarding who should be shielding and how to shield effectively. Digital exclusion has also become a prevalent and significant barrier to accessing healthcare for some people in Scotland. There have been many reasons shared as to why an individual may be digitally excluded, such as access to technology, affordability, and digital skills. There were concerns expressed in responses that inequity of access has widened, as people have sought alternate health supports such as seeking information online to self-manage their condition or accessing private healthcare, options which are not available for all groups of people. Quote, "My family and I will go private in future. I feel for the people who cannot afford that option."